I think that in fact what's happening is that you don't want a swamp. You don't want a stagnant swamp in your brain. Those cells need to be clearing their environment out continuously. You don't want the debris you want your toilet flushing, right? You don't want to leave that environment just sitting there. And that a slowed, swamped, stagnated environment weakens the oligodendrocytes. The oligodendrocytes are the cells that make myelin. That because the oligodendrocytes are weakened, perhaps there's too much nitric oxide, perhaps there's too leftover neurotransmitters. Glutamate has been accused of being a toxin to oligodendrocytes. The myelin falls apart, and the white cells are coming in to clean up the debris. That's actually what has been shown. There's a scavengering going on. The white cells are not coming in to attack myelin. The white cells are coming in to clean up myelin that is fragmented and been damaged by a stagnant swamp. So there are different theories, but I think this is the challenge for neurology going forward. Is okay, we see these obstructions way out peripherally, but what's that doing to the brain? Why is this pathology actually happening? So I run an fMRI lab, and this whole thing feels so impossible to explain coincidentally. What was I doing running an fMRI lab when my son gets diagnosed with MS? So what is fMRI? So fMRI is, instead of taking a snapshot of the brain, it takes a movie of the brain. You get an image every 2 seconds. And so you can see thinking. You can see cognition. So when the brain is activated by a task, looking at something, doing something, those neurons call in extra blood, a surge of blood that comes into the area in order to feed the brain, which is now doing a task. So you get these very detailed images. I'm going to show you this picture in a minute. How it works is that the MRI can see the difference between hemoglobin, which has iron in it, and the hemoglobin, which is oxygenated, and hemoglobin, which is now deoxygenated, and it's now in the venous system. So that's how fMRI, it shows that difference. So just to give you one example of what we used to do, what we do, I was interested in meditation. That was one of the things I studied in fMRI. And so this is kind of a cool image. It shows you what you see. When someone's meditating, what do you think is going to happen? Do you think their brain's going to become very quiet? Do you think their brain's going to become very active? Or something in between? What you actually get is the attention area, the frontal lobes. This is the front of the brain, back of the brain. Vision's back here. The executive function is in the frontal lobe. You get a quieting of the attention area in the brain, and you get an activation in the insula. The insula is where we feel sensation from inside our body. So it's where the research in fMRI, it's where you activate when you feel love or feel compassion. So it's kind of nice that when someone's meditating, you have a quieting of the attention area and an activation of the compassion or love area. It's sort of fun stuff to do, but it's an image of what you get. So I reasoned that maybe a test, this test, the fMRI test, might actually have a role in looking at venous drainage. And the reason is, one of the professors at UCSD, where I trained in this method, Buxton, he had the balloon model. So his idea is arterial flow comes in, and when the cognition is calling in for activation, there's a surge of blood in, and then it goes back out again. And so it surges in, then it comes back out again. But during the middle of that phase, the venous supply dilates a little bit, it balloons a little bit. And so you get a pattern that has been recognized for about 20 years, which is you see an increase in the blood flow, the surge of blood in, then a plateau during the task, and then it drops down. And this is what down here is called the venous undershoot. So this has been recognized for 20 years, well, 15 years, that you do have this venous undershoot in the fMRI signal that needed to be explained, and it's explained by the delay in the flow, the venous flow of blood out of the brain. So I thought maybe this would be a way to have another way of testing this. So I came up with a task. It's called the tell time task, where basically you hear a time of day, 2:30, and then you see two clocks. One says 2:30, one does not say one says a different time, and then you have to choose which was the wrong clock. So it means I'm getting a look at the visual cortex, I'm getting a look at the auditory cortex, hearing it, I'm getting a look at the two motor areas when you move your hands, and then I'm getting a look at the executive area because you have to choose the wrong answer. So it takes effort to choose the right clock. You have to choose the wrong clock. Well, this is what we got. So we've now done about 20 of these, but I'm just going to show you one. So on the right, this is the pattern that I showed you. That I showed before. What you expect to see is a steady increase in blood, a plateau, and then it drops down, and this is the venous undershoot. With the MS patient, you see a significantly greater peak, and then it drops down almost twice as far. So the normal is -1, the patients are -2, and what we discovered is it also goes out further. So I'm going to show you that in the next slide. The venous undershoot is twice as deep, and it's also much longer. So this is now, we've now done, all of our patients have this test done before and after they have angioplasty. So I guess now we have about 20 of them. So this is what the actual MRI looks like. This is not the hemodynamic response. This is just actually what the scan looks like. But even looking at this, let's just look down in this area here. So this is before angioplasty. That's after angioplasty. So there's clearly a difference, but the dramatic effect is in the hemodynamic response. So this is pre-angioplasty. This is post-angioplasty. This is the prefrontal area. That's the executive function. That's the inhibiting the desire to give the wrong answer. Precentral is where the motor task is. The parietal and visual is picking up the looking at the clocks. And it is obvious that the venous undershoot in all regions is much larger before angioplasty than after angioplasty. There's basically a little tiny bit there, but all the rest of them, clearly one can see a really dramatic difference. So I'm actually optimistic that this actually might be another way to evaluate the problems we've talked about today. So which type of abnormality is significant or not. The vessel being a little bigger, a little smaller, the flow being difficult to measure. I'm hoping this might be another way to do it. Because it's actually measuring the cortex directly, right? What we've been talking about so far is measuring the veins in the neck. But of course, what we really want to know is what's the brain response? Is the brain getting cleared out adequately or not? So this hopefully might be a testable way to do it. It's obviously non-invasive. It takes 15 minutes. Of course, what it doesn't do is it doesn't show the location of the obstruction. And then also it doesn't evaluate the spinal cord. So it's how I'm working on pursuing this issue.